So my name is Yana Shah, and I am a high school student in the state of Virginia. Today, I will be presenting my project focusing on breaking barriers by expanding detoxification drugs and access behind bars. I propose a legislative solution to attacking the opioid epidemic and other issues that affect both my community and the United States. Understanding opioid use disorder and its effects on the body is crucial to understanding this bill's necessity. I want you all to consider a scenario where you have intense nausea, vomiting, tremors, and anxiety alongside many of the other symptoms shown in the slide in front of you. Now, envision having all of these symptoms in a small concrete cell with no support and no medication. This unfortunate situation is a reality for 85% of people in prison during opioid withdrawal, many of them suffering from opioid use disorder, in short, OUD, which is a medical condition marked by problematic opioid use. Oh, sorry. My interest in this topic grew after learning at a Harvard University camp in 2023 that the majority of OUD patients detox in jails. I found it perplexing as to why we as a community weren't focusing on the prison population to attack the epidemic if that's where the majority of the patients lie. As I continued my research, I found that only 10 to 12% of jails in the United States provide detox drugs to their inmates, hindering their chances of recovery and increasing their risk of recidivism, which is the tendency of a convicted criminal to reoffend for the same crime after being released from imprisonment. Throughout my presentation, I referred to inmates as patients because OUD is a diagnosable medical disease. They deserve care and support like other patients receive. In most, if not all cases, taking drugs is not a choice, but a curse of brain chemistry, and both society and the government should take steps forward to change the system and treat these individuals as patients who deserve a second chance at life. Despite the availability of more rehabilitation programs, the fact that 68% of individuals with a history of illicit drugs are rearrested underscores the need for alternative solutions. Recent research in Massachusetts suggests a promising shift. A proposed model indicates a 32% decrease in the risk of recidivism when inmates are provided with buprenorphine, a type of detox drug. My proposed bill mandates Virginia correctional facilities to provide medication to inmates with OUD. This initiative aims to lower mortality and recidivism rates, yielding societal and economic benefits. Key points of the bill include allowing patients to start treatment upon entry and providing the drug at no cost. Additionally, all staff should receive training on opioid use disorder with the goal of minimizing the impact of stigma, dispelling tensions between security and medical staff, and improving patient care. While detox drugs may not eliminate all symptoms, they can curb cravings and discomfort, reducing the likelihood of relapse and recidivism. The policy offers not only individual benefits, but also broader societal and economic advantages. By reducing recidivism rates and drug-related crime rates, it can lead to cleaner, more prosperous, and safer cities. This includes a decrease in the prevalence of used needles on the streets and fewer criminals traveling from other areas in search of drugs. As a student currently considering colleges, one of my top choices was Johns Hopkins University. However, one of my main concerns about this school was its location. Baltimore, Maryland has one of the highest drug-related crime rates in the nation, and I wasn't sure if I would feel safe living in that city for 4 years. Not only do these factors drive people and students like me away, but they can also deter businesses, causing these areas to become economically disadvantaged. Therefore, our goal as a society should be to address these problems at its roots by helping people through the use of detoxification drugs. The proposed bill also presents a valuable opportunity for comprehensive data collection. As no states have implemented a similar legislation, tracking statistics is essential to gauge its effectiveness and potential for improvement. To streamline this process, the government could involve undergraduate and graduate students who are keen on gaining experience in government work and enhancing their resumes. Moreover, university professors could establish programs enabling medical students to volunteer and become certified in providing drugs to inmates. This initiative could be promoted and endorsed by the government, fostering collaboration between universities and governmental bodies. I appreciate the concerns raised about this proposed policy, and here's how I would address them. By implementing detoxification drugs to reduce recidivism, we anticipate a decrease in the average cost per inmate per day over time. As fewer individuals return to jail, the associated expenses are expected to diminish, eventually reaching a point where jails can break even, possibly within the initial years of implementation. Moreover, recognizing the diversity in funding allocation across the different regions of Virginia, we understand the need for flexibility. Jails will have the autonomy to allocate funds based on their specific requirements and the severity of their drug-related crimes in their respective areas. For instance, areas surrounding Albemarle Charlottesville Regional Jail are characterized by higher grades, Bs, A pluses, in the drug-related crime rate, and may not require extensive investment in detoxification drugs. Conversely, areas around the Richmond jail detention with lower grades of Ds and Cs may need to allocate more resources. To ensure an informed decision-making process, an educated working group will be established. This group will assess the unique needs for each jail and recommend the most effective approach tailored to their circumstances. I understand there may be other questions and concerns that I did not address, and I would love to hear any questions from the audience. But before, I would like to thank my parents for giving me the opportunity to work with Polygence, my mentor, Nathan Perry, for his guidance throughout this project, and the Polygence team for organizing this event. Thank you all for listening.
Awesome. Just as a reminder to our audience members and fellow panelists, if you have any questions for the speaker, go ahead and put it in that Q&A box. But Yana, one thing that came up is, why do you think that policymakers and community leaders haven't pushed for this kind of legislation previously?
I think a big part of it is just that we don't really think about this specific group of people. Like if someone's gonna say, oh, we have to choose one group to help, no one's gonna say criminals or people that are in jail. People are gonna say, oh, we should help kids, we should help all these other groups. They're just very stigmatized against, and in no way is this excusing anything that they've done to go into jail. But I also think that, I know I'm just in high school, but I mean, I see people change all the time in high school from 10th to 12th grade. And I think even these people could change if they were given the right opportunities and the right support.
Absolutely. Another question that came up, jails within the US system right now are pretty underfunded and overcrowded. Do you think that extra expenses on the detox drugs would hurt prisons before they could break even?
I don't think so, because the overcrowding should decrease like pretty soon. Because I mean, some people reoffend within the first 4 days. So that would definitely decrease. I also think that so for example, as I had given the Albemarle, Charlottesville, and Richmond regional jails, Albemarle, Charlottesville would maybe have to buy like 2 or 3 things of detoxification drugs. They really wouldn't need that much, and they could honestly give the money that was allocated to them to support the Richmond regional jail. So Virginia should work together. It shouldn't be like this jail has to keep all this money. Like, funds can be transferred. It really does not have to be like a strict number.
Awesome. Thank you so much.